I think it was a pretty good experience for students. I got the chance to really go through the levels now and to continue practicing so that I get I told when I get to 100, I go to the next level. So it was a really great experience for students because not many students have this opportunity. And I also see this in the number of registrations. When you think in the beginning, we had a few spots after the first post we made about it. Of the actual sessions, it was full. It was fully booked. And people came back and people asked me, can we maybe sneak in sometime and get a little more practice in? And so people were very excited about it, especially people that are surgically inclined anyways. And it's just such a great advantage over the laparoscopy. I think it is important that they get a feel for it. At first off, it shows them the possibilities that they have. It shows them what can be done. And also, once you get a feel for it and you notice that it moves naturally, for example, your company came last semester in May, we had the Da Vinci here, and I went in and I knew what to do. So this small training last semester already gave me the feel for it to be able to, okay, I turn my wrist like this, I turn my wrist like this and this happens. You know? And I think that's a great possibility for students because most of them will probably never even see it in their residency. And if we go beyond Hungary into other countries, it's even worse. I've talked to attendees who've never seen a Da Vinci in Germany. So I think it's a great way for students to get them interested and also to just give them introduction to it and get the first feel for it. But yeah, and you can really feel the learning curve. Mm-hmm. And I think there was a statistic last semester that showed us that like 10 hours in Da Vinci compares to 100 hours in laparoscopy to achieve the same skill level. And it's just such finer work. Because the laparoscopy, it's one pivot point, stair axis. The fine movement is very restricted, but with the Da Vinci it is not. So I think people can greatly benefit from this and also achieve higher levels in surgery in shorter times of training. If we could, semesterly would be very nice. And as you could see, people were very interested, students were very interested, were very engaged with this. I mean, you got to think, we're in week 11 of the semester. So we are 5 weeks from the same period and people still showed up at 6 o'clock, at 7 o'clock, stay till 8, even though they probably have to study. Because it's also such a great way to get out of the daily university routine of theory and theory and theory. Yeah, so I think that would be a great benefit to the university.